So would you like to see my workspace?
That sounds great.
Great. Okay, if you'd like to follow me, please. So this is my workspace. And Albert has kindly offered to help me with this demonstration. So Albert has kindly volunteered to help me demonstrate some of my techniques and how the body, mind, and spirit kind of work together with different techniques. He's been experiencing low back pain, and he's kind of a jaw clencher. And one of the specialties that I do, not only do I work with pain, but I also work with TMJ and migraine headaches and things like that. And one of the things that people don't realize is that with tension in the jaw clenching, you can just see within my muscles how much tension is created in the neck and shoulders by clenching one's jaw. People are spending a lot of money on night guards and expensive apparatus, but the problem is that that only allows for homeostasis. It prevents the issue from getting worse, but it doesn't help heal the issue. Some of these advanced cranial sacral techniques are actually used to relax the jaw and the musculature in the jaw and rebalance the central nervous system, because it's thought that we clench because of intracranial imbalances in the fluids. So we'll work a little bit with Albert, and you can see how I work. So you're going to wave to me if I'm too hard. You're going to lick my fingers so it doesn't stick to your jaw, the plastic, okay? Thank you. Now I'm just sliding over here, okay? And so I'm just kind of massaging the inside of his jaw. Feel oddly good?
Mm-hmm. I've had it done.
Yes, this is a very rare technique. It's an advanced craniosacral technique, usually done in clinics. But again, I spent a great deal of my career in chiropractic and acupuncture clinics, so I used a lot of pain-specific techniques in my work. I also use moxa and cups up there that are used in Chinese medicine. This is an interesting technique because it's very empathetic. I kind of feel the releases inside myself, and that's kind of how I know he's responding.
I think every dentist should do this.
Yes, he said every dentist should do this, and I agree.
Dental hygienist, maybe.
Mm-hmm.
The dental hygienist.
The dental hygienist, yes. Certainly post any kind of oral surgery, craniosacral would be wonderful. Nasal surgery, maxillar surgery, and really any kind of get pelted by a ball in your face or anything like that. Craniosacral is wonderful. And babies can respond very well to craniosacral. Oftentimes they're traumatized at birth, and that can be all kinds of central nervous system problems later on in life. Well, how do you feel, Albert?
I feel great, right? The tingling in the back, and it was really cannot be expressed in words, in language. And then the tingling continued on the side, and then it was above my teeth. And so I was just wondering what that was all about. But it felt good. It felt good. Thank you so much.
You're welcome. Well, first of all, when you have a great deal of tension, this is the jaw is a hinge joint. And when you're clamped down, not only do you get insufficient circulation of blood and chi, or vital life force energy, but when you're clenching, your teeth also don't get quite the innervation either, because of course they're having to grip down. So I increased the amount of circulation and blood flow and so forth, and just kind of stimulated the gums and got all that energy moving. And with the relaxation and the increased blood flow, then your whole body can kind of relax. And what I noticed physically is that your face looks different. You look more relaxed. It feels like it looks like you've got. I also noticed that your neck relaxed a great deal more after I did your jaws, and that's typical for that. It's so interesting how much neck tension is actually jaw tension.